Hello everybody. Today I would like to present you our study results concerning the teleguided education system from Navilas and also give you a short insight into our everyday experience with the system. So as a short introduction, here are some of the various indications for retinal laser therapy even nowadays, ranging from diabetic retinopathy over vascular occlusions, but also including urgent indications such as retinal breaks. So what are the challenges for laser education nowadays? On the one hand, there is a high demand for laser treatments, as could be seen through the different indications I just showed you. On the other hand, there's very limited time of the experienced ophthalmologists to actually teach all the new residents. And there keeps on coming new residents which all need a thorough education of retinal laser therapy to be able to conduct it themselves. A teleguided concept, in order to help with this problem, consists of 3 steps. The initial step is the theoretical part, which is meant to teach the residents the laser basics through an online course, as well as through planning their own cases in the Navigate app. So while they are watching the online course, they have the Navigate app and they can actually plan the cases themselves and then compare how they were planning the different cases in the Navigate app with what is shown in the online course as an example. Solution. Afterwards, there'll be the remote observation phase where there's an expert in the treatment room together with a patient who is planning and conducting the laser treatment, and at the same time the resident sitting in the auditorium or in an office can actually observe every step that the expert is taking while conducting this laser treatment. Here in our study setting, the participants were supposed to see 5 focal treatments and 5 peripheral treatments conducted by the expert. And then the last step is the supervised treatment phase, where the residents themselves sit in the treatment room with the patient and the expert is observing from their office. This gives you options of supervised planning, a supervised treatment phase, and also real-time feedback from the expert to the resident, and of course also the possibility for the resident to always ask questions whenever necessary. And the expert even has a possibility for an emergency intervention if there should be an urgent situation where they want to intervene. So here you can see an example of how this teleguided concept actually works. The expert is now opening the remote session on the Navilas screen, and once this session has been opened, the students can then use the Navilas remote client to enter the session and to then observe every step that the expert is taking, so that they can see the planning phase but also the treatment phase, and they can then also see the report that is being created in the end. And the other way around, of course, the expert can also use the remote access to observe how the student is planning the case and treating the case, and the expert can also use their mouse to give feedback as to where they would put the spots or what they would do differently. So in the study, we then did a testing to see how well this teleguided concept actually worked, and for this we had a graded exam of the treatment quality where the experts were examining the residents, and they were giving grades concerning the spot placement, the power definition, the device handling in general, and also the time consumption that the residents had. There we had a scale from -1 to 2 points, and we had a maximum points of 24 for the focal laser therapy and 20 points for the peripheral treatments. And on the other hand, we also had a survey questionnaire for the residents to see how they perceived their safety during the training and the exam, and how they perceived their confidence during training and exam, but also to see if there were any difficulties with the remote connection. Here we had a scale from 1 to a maximum 10 points. All in all, we can say that during the study we had no technical complications and no unforeseen events, so the emergency intervention module did not have to be used by the experts, which is already a very good result. And then we can see here that in the graded exam, all 4 participants passed the exam with an average of 89% of all maximum possible points. And here you can see the different points that have been achieved in the pan-retinal laser therapy, peripheral laser, and in the focal laser treatment. And we also have the results from the subjective survey. Here the students gave a median of 9 of all maximum 10 points, and the perceived safety reached a median of 8 points. And we could see here from the feedback from the students that the biggest challenge was actually adjusting the live image view, which is why I added an additional imaging session for the last 2 participants, and they also reached a higher subjective safety after this additional imaging session. So our conclusion is that the teleguided education for retinal laser treatment is technically feasible, that the standardized concept and the well-documented procedures ensure an effective training for the students, and that the Navilas teleguided education therefore allows an easier supervision, a better communication between the expert and the residents. So here are some short examples for the peripheral and the focal laser treatments. And as you can see here, the expert has already done the planning of the peripheral laser spots and is now conducting those spots, and everything that he can see on the screen right now can also be seen and observed by the students through the remote access. And here you can see how these laser spots looked after a while. So here you can see an example for the focal laser therapy, which also starts by taking the fundus image of the patient and then using the overlay function to put the OCT image and the fluorescein angiography image on top of the just obtained picture. And now you can see the expert is planning the case initially by adding the safety zones where he doesn't want to put any laser spots, and then planning the laser spots in the certain areas as well as the titration spots. And this entire process of planning can be observed simultaneously through the remote access, which allows for the expert to give feedback, for example, concerning the laser spots placement and also the safety zones. And here you can see how fast the actual treatment is then being conducted. And in the end, you will have the laser report, which can be saved. So now I want to give you a short insight into how we actually use the teleguided education module now in our everyday life, in our clinical practice. And we also start with the initial teaching phase, as I just described to you, which consists of the theoretical laser basics initially through the online course. And then we have the observation phase, which is either remote or in person. It all depends on how it works with the schedules. And then in the end, there's the supervised treatment phase. As you can see here, one of our experts is sitting in their office while observing the Navilas screen from one of the residents. And this allows us for an early independent laser treatment because there's always the possibility of occasional remote observation. So the expert can just have that screen opened while doing other work, and they can just every now and then have a look at the planning or even at the treatment phase and give real-time feedback to the students. For example, if they think that the power should be increased or the laser spots should be put differently, they can always give this real-time feedback. And on the other hand, of course, the resident also has the possibility of asking questions, of getting some supervision whenever required, which is often the case for the focal laser therapy initially, which can be a bit more complicated than the peripheral laser therapy. So this is often being used by the residents to ask questions and to get feedback for their planning and the treatment itself as well. So all in all, this allows us to get an early independence of the residents in laser treatments while maintaining a high safety for our patients. Thank you very much for your attention, and I hope you all get to try this remote teleguided education system. Thank you.